During this short video, we will show you how to self-administer your Bemfola injection. We are here to help. Bemfola is given as a subcutaneous injection. Self-administering an injection may seem scary, but this video will explain what you need to do in easy-to-follow steps. Remember that if you have any questions, your nurse, pharmacist or doctor will be happy to help you. First, let's get familiar with the Bemfola pen and its various parts, as we will be referring to these during this video tutorial. Bemfola is available in 5 different pens. Each colour represents a different dose strength. Your doctor has prescribed the correct dose for you and the most appropriate Bemfola pen for that dose. The pen looks like this, with the following parts: the dosage knob, activation bar, medication cartridge, needle, inner needle cap and outer needle cap. Take a minute to identify the different parts on your pen. Your doctor will have told you the dose, described as international units or IU, to inject each day. Okay, let's get started. There are 3 simple steps you need to follow: preparing your Bemfola pen, setting your dose, and giving yourself the injection. Here are some general handy tips. Administer your Bemfola injection around the same time each day. Wash your hands with soap and warm water and dry them completely before you start. Store Bemfola in the refrigerator at a temperature between 2 and 8 degrees Celsius in its original package. Do not freeze Bemfola. If Bemfola has been frozen, do not use the pen. Contact your nurse, pharmacist or doctor and inform them. Once Bemfola has been taken out of the refrigerator, the unopened pen may be stored at or below 25 degrees Celsius for up to 3 months without being refrigerated again. It must be discarded if it has not been used after 3 months or if the expiry date has passed. Let's start. Preparing your Bemfola pen. Take your Bemfola pen out of the refrigerator 5 to 10 minutes before use. Check the medicine has not frozen. With clean washed hands, remove the peel tab from the injection needle like this. Do not use the needle if the seal is damaged or loose. Hold the pen by its sides and keep the needle in line with it while attaching the needle. Screw the needle clockwise onto the tip of the pen all the way until firmly attached. Make sure that the needle is properly secured on the pen in a straight position. Next, remove the outer needle cap. Please keep this outer cap, as you will need it later when discarding the used pen. Then remove the inner needle cap. Check that the needle is in the correct position. There should not be a gap between the needle attachment and the medication cartridge that contains the Bemfola. To set your dose, start by holding the pen with the needle pointing upwards. In this position, gently tap the pen. This allows any existing air bubbles to rise to the top. With the pen still in the upright position, push the dosage knob in until the activation bar with the small arrow disappears. The pen will then make a click sound when you have pushed the dosage knob far enough. Some things to be aware of at this stage are a small amount of liquid may splash out of the top. This is normal. If no liquid splashes out, or if liquid is detected at the junction of the needle and the pen, then do not use the pen. Contact your nurse, pharmacist or doctor and inform them. Any small bubbles that remain are harmless. Make sure you cannot see the arrow in the activation bar once you have pushed the dosage knob. Okay, that's the first part done. Now let's set the dose. Gently turn the dosage knob until the bar of your prescribed dose is in line with the middle of the indent of the pen, like so. Please be careful not to push the dosage knob any further at this point, as the pen is now ready for injecting. And please note that for the yellow Bemfola pen, which is the pen with the lowest dose, the dosage knob cannot be turned all the way round, but can be rotated in both directions to access all of the potential doses. You have now prepared your pen and set your dose. All that remains is to administer your injection. Giving yourself the injection. You can inject yourself with Bemfola in your tummy or the front of your thighs. To minimize skin irritation, select a slightly different injection site each day. Start by cleaning the skin of your selected injection area with an alcohol swab using a circular motion. Wait a couple of seconds for the skin to dry. While you are waiting, double check that you have set the pen to the correct dose. Next, pinch the skin lightly and holding the pen at approximately a right angle, 90 degrees, fully insert the needle completely in one steady movement at a medium to moderate pace. Now push the dosage knob slowly and continuously until it stops and the dose bar disappears. Wait for about 5 seconds before pulling out the needle. After withdrawing the needle, clean the skin with an alcohol swab in a circular motion. If you see any liquid leaking from in between the needle and the pen during or after the injection, tell your nurse, pharmacist, or doctor. Congratulations, your injection is done. Please remember, you can only use the Bemfola pen once. It must be discarded even if liquid remains following your injection. Now let's clear up. Carefully replace the outer needle cap onto the needle. Put the pen in a sharps container and return it to the pharmacy for correct disposal, or ask your pharmacist how to dispose of medicines you no longer use. The pen packaging box, inner needle cap, peel tab, alcohol swab, and the instructions for use can be discarded in your household waste. Please remember to protect the environment. Do not throw away any medicines via your sink, toilet, or in your household waste. Ask your healthcare professional how to dispose of medicine you no longer use, and ensure you follow your local disposal and recycling regulations. Hopefully that was easy to follow. You need to do the same thing each time you inject. If you have any questions or are unsure about something, just ask your nurse, pharmacist, or doctor. Please ensure you read the information leaflet enclosed in the Bemfola pen box. Please find the full version of the SMPC by scanning the QR code below.